Usually I choose something that I've been running into with my clients as far as their needs or questions that they have. And so that's a result of what I'm presenting to you today. So I'd like to talk about your caregivers, and I'm talking about your in-home aides, those on the registry, those not on the registry, and your companions if you have those. I'm going to talk about how you supervise them, what the requirements are, and a little bit about the yearly evaluation that all of your employees should have. Okay, so the home caregivers is what I'm generically calling them. And as I just mentioned, it's the in-home aides, those that are listed on the registry and those that are not listed. You know that you can have both if you're an in-home aide agency, meaning you have a nurse that supervises your aides, an RN. And the companions, the way that they are supervised in the time period is a little bit different. But I will say, since the in-home aides get supervised a little more frequently than the companions, a lot of the agencies I see, they put them all on the in-home aide schedule of supervision, because that way you know you're covered with your companions. And I always did that too. I put all of them together. Since I was an in-home aide agency, I put all of them on that schedule, and I knew that I would never be late with my companions. So the in-home aides have to be supervised every 90 days. And at this point, that is exactly 90 days. There are some calendar apps where if you go visit someone today, you can key today's date in and it'll tell you what that 90th day is. Now, it doesn't have to be a full 90 days. It can be 85 days. I was talking to an agency a few days ago and they try to get it done within 85 days, but it should not be more than 90 days. There are going to be times when it doesn't happen. The client may be in the hospital, something may be going on. That's why if you start at day 85 or 86, you may be able to get it in. However, if they are away, make sure you do your documentation. If you miss it and it's documented that they're not available, then that's what you should do, because that's what the surveyor will see when they come in to look for that. The companion sitters are to be contacted quarterly, and they should have at least one physical visit in the home. And for both of these, the caregiver should be present during at least one visit a year. And just to clarify that a little bit, say if it's an in-home aide and you're going out to that client to supervise the aide and to review the client 4 times a year, then on one of those occasions, the in-home aide should be there. It is good that you go at times when the aide is not there, because sometimes you get additional information from the client that they wouldn't otherwise say in front of the aide. It may be good or bad, but it's just good to go sometimes when the caregiver or aide is not there. On the companion sitters, I believe you can make contact by phone on a couple of these. But if you're going to really run an in-home aide agency and you put everybody on the schedule for the in-home aides and treat them accordingly, you will always be in compliance. So when you go out to visit in that 90-day cycle, there's an assessment that you should do about the caregivers overall, everything that they need to be doing. We know that there's an ID badge law in the state of North Carolina. Anyone doing healthcare should have a name badge. Most of them have a picture on it, and it should have their title. That is very important, because it's especially important in facilities and in hospitals, but you also need that in home care. When I was doing this, I had a really hard time with keeping my aides wearing their name badge, because they're going to the same place every day. Some of them lose it or whatever. So I had at one time put in an incentive to get them to wear it. And I said, if I come out for a visit, or if a nurse comes out for a visit and you have your name tag on, then we will give you a $10 bonus or whatever on your check for wearing your name tag. or you just, of course, it's in their job description somewhere. I hope that they wear it, but just an incentive for them to put it on every day, even though they're going to the same house and everybody knows who they are. But we have other modalities coming into the home. The physical therapist may come, the OT person, and if that aide has their name badge on, they know their name, the agency that they work for. So that is important. And we have the law in North Carolina. The service logs, that is the documentation that the aide puts up every day for the tasks they've done for the client. If you're still doing paper, then you should be reviewing those when they come into the office, at least on a weekly basis. But if most of you are using some type of electronic visit verification, an RN or someone should be going into that log and looking at those to be sure that tasks are not being missed. Now, all of your aides, and this should be part of their evaluation, if anything changes with that client or goes wrong, they need to be calling you and letting you know that something has happened and that maybe they need a reassessment or that you need to react to it as an agency or a nurse. But review those service logs, because if they don't call you and they haven't given Miss Jones a bath in 3 days and she's supposed to get one every day and no one reported it, you would see it. It's just a second check on the task that you've assigned. And then you should always ask if the client or family member is satisfied with the services. Most of the time, if they are not satisfied, they are going to call and let you know that they are not getting the services that they need or that they're not satisfied with it. One thing that I used to tell all of my clients when I admitted them, I would say, you are my eyes when I'm not here. If anything goes wrong at your house, if you're not satisfied, aide showing up late, all of that, please call and let me know. Don't wait until I come back out here in 90 days if it's that long and you've been dealing with it for 87 days. So when I walk in the house and they say, well, this is going on, and I let them know I can address it now that I know about it, but if you just call me, I can address it and come back out at any point. So get your clients and family members engaged in the process. Let them know that they need to let you know what's going on as well, and not just wait for you to show up or to call. And then we know that standard precautions, hand washing, and then masks came into play. We know that that's something that they should follow. You all, I don't know how you're dealing with masks right now, but if definitely going forward, if anyone in that home is sick with the flu, cough, sneezing, whatever, that might be a time for your aide to put their mask back on and to let you know. If you show up, nurse, at the door and someone in there is sick, they need to let you know so that you can put your mask on, because now we've learned a lot about what masks can do for things other than COVID-19. During the time of COVID-19, there was virtually no flu in the community. But now that the masks have come off, the flu has come back. So we know masks are beneficial in a lot of ways, and your agency should have a policy for that. You need to check to be sure that your caregiver is following the plan of care. Hopefully you have the plan of care right there in front of you. You can look at it, be sure, as I said, they're giving the bath every day, that they're doing all the things on the plan of care. If they're not, and it's no longer needed, then that plan of care may need to be revised. And once you revise it, if there are services that are added that were not there in the first place, and you need to be sure that the caregiver has the training to do that. If you go into a home and now there's a hospital bed in there or where you live, hopefully you know about this ahead of time. You need to be sure that their skills are updated and that they can handle that piece of equipment if your agency does that. Always ask the client their opinion. You know, I used to always say, is there anything else that I didn't cover? Anything else you need me to know while I'm here? And just make note of that during your caregiver supervision assessment. And then every one of your employees should have an annual evaluation. The number one thing I think we care about in home care mostly is that are they getting to work on time? That is very important. That's one thing that you definitely want to put as part of their evaluation. There's times when they're going to be late, they need to go in late, but are they letting you know that that's happening and not showing up at, at the wrong time every day? Now with electronic visit verification, you will see that. As I said, someone should be reviewing those logs, reviewing that time. Someone in the office, a nurse, mostly would be the right person to do it so that you really see what's going on. If there are status changes with your client, are they communicating with the manager, which would be the nurse or the agency director, or maybe even the scheduler, because the scheduler can get that information to the nurse. So be sure that they're communicating with you, because a lot of things can happen between those 90-day visits. Is the client working well with is the aide working well with the client or family? Is there synergy? Hopefully you know about this up front. If you make an assignment of an aide and it's really not the right person, I always used to tell my new clients, we're going to send this person to you. This is not permanent if it doesn't work. If this aide doesn't work out, if things don't work, we will change it. You let them know that, so that you send them one person and they're like, oh, well, they sent me somebody I didn't like, I'm going to another agency. Don't even give that possibility. You let them know, we will change your aide, we will send you someone else, whatever we need to do. Give us a chance to fix that. Pick up the phone, call us, and let us know. And of course, you do an investigation. You talk to the aide. Sometimes the family thinks it's okay, but the aide doesn't. You may have situations where an aide says, I will not be in a home where someone smokes. And you go out and the family says, oh, no, nobody smokes. But then later on, the aide gets in the home, there's smoking going on, and they just can't tolerate it. So it goes both ways. The client may want a new aide, or the aide may want a new client. As far as agency resources, you should be supplying PPE, mainly gloves, masks, those things you should supply. And then I used to supply a gown covering, especially if someone had shingles or something like that. I would make sure, if I knew that about a client, I would put gowns in the home, because a lot of your aides are going from one client to the other. And so you don't want them taking their clothing being contaminated when they go to another client. But the thing is, you need to be sure that they're using those supplies effectively. There are aides that work for you that work for another agency that may not give them gloves. And so you're supplying gloves, and that aide may be using them with a client that doesn't belong to you. It happens. I know you all know it does. And I used to address that. We even started to log out. If we sent them gloves, which would be 100 gloves, we would put down, okay, we sent this on February the 2nd. And if they came back in 2 weeks and said they needed more gloves, we knew that they didn't use those with that client. They had used them somewhere else, or they lost them, or whatever. So you have to sometimes keep track of that when it's excessive. But you want to know that those aides are using the resources, because that's a cost to the agency. You want to be sure they're using those resources effectively. And then documentation, whatever task they're performing, you want to be sure that it's documented on their service logs, and that it's there in the way that you taught them to do it as an agency. And then any other observations that you see with the aide or concerns, good or bad, you need to notate those on their annual evaluation. Don't wait until the end of the year. Hopefully you're addressing those things as time goes on, but there may be some situations that happen actually that you want to put on the annual evaluation because it was significant enough for you to have to address it in whatever way. And so make sure that you address that, good or bad. So as each month, I let you all know I am happy to give you this information. I love these forums, having you all come each month. But before you make any major changes in your agency, change your rules or whatever, you go to the agency that is responsible for that particular area, and you make sure that they say that it is what you should do. You take this information, but you validate it before you make a change to your agency. So that is what I have prepared for you all today. I'm going to open it up for questions if you all have any. So does anyone have any questions or comments? I would love to hear some comments today if you all have anything that you would like to share with the group.
Hey, Patty, this is Frank. I have one question.
Okay.
Thank you. That was great. It did trigger a question that kind of the balance between a revision to the care plan versus requiring a reassessment. And the thing I can think of recently is actually kind of a reverse situation in that the client came home from the hospital or was hospitalized, and so we did do a reassessment of her needs, and then now she's getting better and better. And if you only have one thing, it's kind of simple. Then you might just go out and do it. Like now, she doesn't need to walk with a walker any longer. She doesn't need any help. And the caregivers noted that. And so we're trying to decide, okay, do we just update the care plan, or we, have the nurse go out and visualize it herself? And, we just decided to do that since they were close, but that's just one thing. But if they had, 3 or 4 or 5 things on the care plan, would you have to go back out 3 or 4 or 5 times over a 2-week period? That seems kind of expensive.
Yeah, well, that would really be based on your nurse's judgment. Something like mobility, she doesn't need a walker anymore. I don't know that a nurse would really need to go out there for that, but she could make a note of it and maybe not have to rush out there. But if it's that someone came home and now they have a Hoyer lift or it's a higher level of care, a nurse would want to go see that. So just kind of leave that up to your nurse's judgment. Now, as far as what you mentioned, no longer needing the walker, that was a change in mobility, which is one of the 5 ADLs. So it may have been limited assistance before, but it just changed to supervision. And so once you look at that, does it change the type of aid that they need? But if the person already had an aid that was on the registry, it doesn't matter. But that's where you nurses need to really pay attention. If there's a change in status or the level of assistance with one of the ADLs, does it mean the aid needs to be changed? But Frank, if I were you, I'd leave it up to that nurse's judgment, because nurses know we do assessments and we want our paperwork to match what we see and what the reality is. So just leave that up to your nurse. I think that would be a good call there.
No, I don't.
All right, it's good to see you. Anyone else with a question or a comment? And it doesn't have to be about what I just spoke about. If you have a question about something else that's not related to what I spoke about today, please feel free. We can take care of that too. All right, so I have recorded this and I will get it up on our YouTube channel within several days. We've been kind of busy, but I'll try to get that up there so that, and you all know where our YouTube channel is. And usually I'll send you an email to let you know that it's available. So if there are no more questions, I'd like to thank you all for coming today. We will also, again, have this meeting next month, and we will notify you by email as we have today. And you all have a good weekend and rest of the month, and we will see you all next month. Thank you.
Thanks, Patty.